If you're walking around like Scrooge McDuck with your feet pointed outward and you want to know how to fix it, then stay tuned. By the end of this video, I'm going to give you the program that you need to correct your duck feet for good. What's going on, everyone? My name is Justin with Whiteside Wellness, and like any problem we encounter, it's important to address the root cause and attack it head on from there, as opposed to just relieving the symptoms. And with that said, if you find that your feet are remaining in an externally rotated or pointing outwards position, then the root cause could be a few things. So the two most common causes of duck feet that I see are that the muscles of the hip are causing the femurs or your thigh bones to rotate outwards. The other common cause that I tend to see is that people tend to have limited ankle dorsiflexion. So in today's video, I'm going to show you how to determine which is the root cause and what you need to do to correct it.
Let's first discuss how to diagnose for externally rotated hips. What you're going to do is stand in front of a mirror, or you can just look down at your legs and look at which direction your hips are pointing. If you find your upper leg, knee, and feet are all turned outward, then the hip joint is externally rotated on the pelvis.
If this is the cause of your duck feet, then we can pinpoint which muscles are responsible for causing the excessive external rotation. Now, the muscles that are tight in this instance would be your hip external rotators, which consist of these muscles here located in the glute region. Now don't worry, you don't need to know anything about these muscles except that they're responsible for externally rotating the hip. Now that we know which muscles are causing the external rotation, we now have a three-step plan of attack. Step one is to incorporate some self-myofascial release, where we smash a ball into our overactive or tight tissue, which is our hip external rotator muscles. Now after that, we're going to go into step two, where we lengthen or stretch those overactive hip external rotators. The last step, step three, what we're going to do is we're going to strengthen up the muscles that are responsible for hip internal rotation, which should bring your legs back into alignment.
To release the tissues that are trapped in a shortened or tight state, we're going to use a lacrosse or tennis ball and jam into the parts of the upper posterior chain that feel overly tense. To start, what you want to do is position your ball on the side of your hip. Again, don't worry too much about which muscles you're trying to hit specifically. Just position the ball on the glute and you'll be fine. Once you feel the ball has taken up the muscles, move around by bringing your knee down to the floor and back into the center of your body. Slowly roll from side to side across your glute, readjusting the ball if you have to. If you find a painful area, contract your glutes for a few seconds and then release and relax until you're able to really dig that ball into your butt. Set a timer for 2 to 5 minutes, just working the ball on this area, and once you're done, move on to the other glute for 2 to 5 minutes. Once the external rotators have been smashed into, it's time for the next mobilization, which is stretching the external rotators of the hip. Start by finding a box, chair, or table. Sit halfway on your box and drop your right foot off the edge. Keeping your back straight, fold forward from your hips and lower your chest towards your right knee. You'll feel the stretch in the right hip. If you'd like to feel a little extra in the hip, you can take your knee and gently pull it up into your chest. Hold this position for 1 minute. If you find this stretch isn't really doing it for you, you're more than welcome to take it down to the ground and go into a pigeon position, assuming that this does not hurt your knees in any way. The final step is to strengthen up those muscles responsible for hip internal rotation. The muscles that are responsible for this are the TFL, adductors, and parts of the glute medius and minimus. To strengthen these muscles, we will perform a seated hip internal rotation using a resistance band. Start by taking the band and placing it slightly above your ankles. Keep your feet shoulder width apart and remain in an upright position. You can place your hands on your sides or behind your back to help keep your spine in a neutral position. Begin with your right leg and keeping your left foot flat on the ground. Raise your right foot to the side of your body as if you're trying to bring the outside of your right foot to the sky, and then return it back to the starting position on the ground. You want to perform 10 to 15 reps on the right leg, then switch over to the left leg. Complete 2 sets on each leg.
If you've tested and found that your upper legs, knees, and feet were not externally rotated, but you're still walking with your feet pointed outwards, then the next step would be to test your ankle dorsiflexion, as this may be the culprit of your duck feet.
To diagnose whether duck feet is a result of a limited range of motion in your ankle, you first want to test if you have restricted dorsiflexion or your ability to bring your foot to your shin bone. To test for this, face a wall and assume a lunge position so that your front foot and knee are touching the wall. Next, keep your knee touching the wall, but slide your front foot back as far as you can without your heel lifting off the ground or your foot arch collapsing. If the distance between the tip of your big toe and the wall is less than the width of your hand, then you may exhibit limited dorsiflexion.
If you're experiencing a lack of dorsiflexion, then your calf muscles, primarily your gastrocnemius and soleus, are tight and are probably the cause of your restriction. Our plan of attack for a lack of dorsiflexion is similar to our plan from earlier. So we'll begin with smashing the overactive or tight tissue that is on the back of the lower leg, prepping it for greater lengthening and stretching, and then we'll follow that up with strengthening up the underactive or weak muscles that are responsible for ankle dorsiflexion.
To smash into your calves, what you want to do is grab a foam roller and sit on the floor. Position the roller on your calf and heel cord, crossing your opposite leg over your shin to add additional pressure onto the calf muscles. Begin by moving your leg from side to side and pointing and flexing your toes. Continue rolling upwards and moving your legs side to side until you reach the top of your calves. If you feel any trigger points along the way, contract your lower leg muscles for 5 seconds, then relax them instantly to allow the foam roller to get deeper into the knotted tissue. Spend at least 2 minutes rolling out before switching to the other leg. After the gastrocnemius and soleus have been rolled out, you can now mobilize them even more against the wall. To begin, stand a couple of feet from a wall and place the ball of your foot high against the wall, keeping your heel planted to the ground and your knees straight. Be sure to keep your foot pointed forward and your glute and abs squeezed. Next, move your weight toward the wall, keeping your legs straight and heel in contact with the ground. This will primarily mobilize the gastrocnemius, but you also want to mobilize the soleus as well. To do so, lower your body down by slightly bending your knee, keeping your weight forward with your glute and abs tight. You may slightly rotate your knee internally and externally to determine if there are certain parts of your calves that need more attention. Spend 1 minute on each side before switching to the other leg. The final step is to strengthen up those muscles responsible for ankle dorsiflexion, primarily the anterior tibialis. To strengthen the anterior tibialis, we'll first take one side of our resistance band and tie it around a heavy, stable object such as a chair, a pole, or a weighted plate. Loop the other end of the band around your foot while in a seated position with your legs extended forward. Next, pull your toes up and towards your shin, keeping your knees straight. Bring your foot in slow and controlled, then hold the ending position, or the isometric contraction, for 1 to 2 seconds before slowly extending the foot back down. Perform 2 sets of 10 to 15 reps on each leg.
I recommend doing one or both of these programs based on the root cause of your dug feet every day post-workout or right before bed. Making these a part of your post-workout or nighttime routine will pay dividends in the long run and should cause you to see the most improvement in the least amount of time. Another thing you want to do is test your hip external rotators and or your ankle dorsiflexion to make sure all your efforts aren't for nothing. If you are consistent with these stretches and strengthening exercises, then over time you should notice that your legs are going back into a neutral position and your ankle dorsiflexion is increasing when you do the knee to wall test. That's it for this video. Thank you so much for watching. I hope this video was able to help you out, and if it did, please give it a like and let me know in the comments below if you have any questions. Before you go, don't forget to share this video with someone you care about who could use some help correcting their dug feet too. Thanks again for watching, and I'll see you in the next video.